Pro Group Management, workers' comp that works for you.
Welcome to Nevada Newsmakers. I'm Randi Thompson, sitting in for the vacationing Sam Shad. We'll be talking to Caleb Cage today. He's the Director of COVID-19 Response for the state of Nevada, talking about where our state is and why it's important to wear a mask. Coming back on an all-new Nevada Newsmakers.
Hello, is this D&D Roofing?
Yes, it is. How may I help you?
You did such a great job on my roof. May I speak to the owner?
I am an owner.
Oh, can I speak to your supervisor?
Sure.
How may I help you?
I love your work. May I speak to the owner?
I am an owner. We're all owners. Well, that's why at D&D we work so hard to keep your home safe and sound.
Oh, no wonder.
D&D Roofing and Sheet Metal. Local, employee-owned, here for you.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
Pro Group Management offers workers' comp services to a growing number of industries. As businesses grow and change with the times, the need for a solid workers' comp program must be flexible and up to date. The evolving nature of regulations can make staying ahead of complex tasks challenging. But Pro Group Management simplifies the work so your industry can move forward and succeed. Pro Group Management, workers' comp that works for you.
Truck drivers are some of the hardest working people you'll meet, delivering over 70% of America's freight and 92% of Nevada's. When there's a natural disaster, they're delivering critical supplies to help those communities recover and rebuild. Every sector of the economy and our nation's military rely on truck drivers. So let's take a moment to say thank you. On the open road or city streets, our truck drivers are rolling to make our economy and our nation stronger. Trucking moves America forward.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And welcome back to Nevada Newsmakers. I'm joined today with Caleb Cage, who's the Director of the COVID-19 Response Team for Nevada. Thank you for finding some time to join us.
It's a pleasure to be here, Randi. Thank you.
Busy guy.
Yeah, there's a lot going on.
So I've followed your career. I've known you for several years. I've always been impressed. First, thank you for your service in the military. July 4th weekend just passed, and I always think of our military, and I thank you for your service that you did several tours in Afghanistan and Iraq. Yeah. So welcome back to the other part of now our American response here of a disaster. So you know, military, you worked for Homeland Security Director under Governor Sandoval.
Right.
Then you did a little stint with the university trying to help with community colleges, and then the governor called you for this?
Yeah, so end of March, there was a structuring that took place involving the Department of Military for the state. And they being the Department of Military and the governor asked me to come back and do something on a temporary basis to assist with the response. I had been the emergency manager for the state for 4 years prior, and so had some experience not with the pandemic, but in the overall logistics side of emergency management. So they asked me to come back, and it was supposed to be a few months. But it was clear that the problem was persistent with this, and so when Governor Sisolak asked me if I would stay on full time, the obvious answer was yes.
So why would you take a job like this?
It's a good question. I think you know, when you have something to offer, and I hope I do, to a situation like this, people are hurting, people are struggling. The state's in a very critical, the nation's in a very critical situation right now, and so I love my state. I love the people who are working really hard to help solve this, and trying to help the economy reopen and stay open and those sorts of things. And plus, I was very impressed with what I saw with the Sisolak team, and really making hard decisions, critical decisions for the state, and trying to do so in a way that was really putting the health and safety and every aspect of well-being in the state of Nevada first.
Well, he's gotten a lot of criticism from both sides, but now I think there's also every governor and every mayor has gotten criticism. We've never done this before.
This is an unprecedented time, and I know we use that word a lot, but it really is. It's extraordinary, and there's always room for critique and to say, hey, what can we learn from these things? What are our lessons learned from this? And I think that's something we engage in daily. Yeah. But yeah, you're right, and nobody's got the playbook for this one.
Yeah. So, what's a day-to-day job for you? What's a day look like for you right now?
It's really interesting. We were talking about this yesterday, and it is very interesting to think about it, because we are still in crisis management mode. We're more in crisis management mode today than maybe 3 or 4 weeks ago, but that means that what we are doing is really working on putting all of the critical pieces in place that help us respond to where we are with the crisis as it stands right now. And that doesn't mean that people have been sitting on their hands for 3 months or anything like that, but the crisis, the pandemic, the virus has changed the way it's not necessarily the way it's behaved, but the way we've responded to it and how those two things interact. And so constantly trying to reconfigure, reset, and make sure we're doing absolutely everything we can. So what's a normal day like? It's we spend a lot of time trying to inform people through opportunities like this, to say, this is really serious and you need to take it very seriously. And there are consequences statewide for this, and we have to work together in order to defeat this in the long run. And so it's those things. It's making sure that we're getting the information we need, that the governor is getting the data he needs in order to make decisions on behalf of the state, and really working with our local partners and our tribal partners throughout the state to make sure they have what they need.
Okay. So as of yesterday, 22,000 cases, about 18,400 are in Clark County, 537 deaths, of which 439 are in Clark County. And Thomas Schrank, from the Dean of the University School of Medicine, was on last week saying, what I would tell people is, don't pay attention to the number of cases or the percentage of tests that are positive. Pay attention to the hospitalizations. Mm-hmm. That's really what this is all about. People are going to get sick. People are going to die. What we're trying to do is not flood our hospital system. Yeah. Is that a correct statement?
I'd say that's part of how I would interpret Dr. Schweig's comment. Okay. So one part of it is very much hospital capacity, right? Mm-hmm. And that is something that we're managing and monitoring on a daily basis, and in fact several times a day, to make sure that we have the space in our hospitals throughout the state to treat the patients who are in critical. Who need the critical care of an ICU or something like that in order to survive. The other part of that is I think it's implied with what he's saying, and even with how you restated it, is there are people are going to get sick, as you said. This is a virus that until there is a vaccine or some miracle that can get rid of this among us. This is going to be a disease that we live with for a long time, and there are going to be people who get sick, and those are going to be in a much less acute and much more treatable way, and we want to prevent them from spreading it further, but they basically need to ride it out, if you will. They need to get healthy on their own, but that hospital space is that critical asset resource for the state.
Okay, well, we're going to come back and talk a little bit more about hospitalization and how we're doing there, because that really is what we're really trying to monitor a lot. Mm-hmm. So we'll be right back right after this.
I can't do it. Stupid, like my mom. We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you.
I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Because of UMC, I'm putting my free time to good use.
Because of UMC, she keeps me on my toes.
Because of UMC and this guy, I'm here.
UMC, the highest level of care in Nevada.
Hi, I'm Eric Robnett, owner of Home Energy Experts. Has this ever happened to you?
Honey, did you remember to turn down the thermostat?
Forgetting to set the temperature? Not fun. We can help. Our new smart thermostat keeps the temperature set for your comfort all by itself.
I'm feeling hot now.
To increase your comfort, go to homeenergyexperts.com for details. That's homeenergyexperts.com.
The signs and symptoms of cataracts can start out small with subtle changes in your vision. So don't wait. Be proactive and take your vision into your own hands. If you're experiencing the onset of cataracts or just have questions, contact your eye care professional or call Eye Care Associates of Nevada today. Dr. Hiss has years of experience specializing in the surgical correction of eye disorders and has completed over 84,000 vision correcting procedures. At Eye Care Associates of Nevada, we'll change the way you look at the world.
This is Nevada Newsmakers.
And we're back on Nevada Newsmakers with Caleb Cage, the director of COVID-19 response. So we talked a little bit before the break about hospitalizations. How are we doing? Do we have capacity? Are you concerned? I guess it'd probably be yes and yes.
Yeah, yes and yes. That's right. That's right. I mean, I think if we weren't concerned right now, we wouldn't be watching the numbers. We wouldn't be watching all of the numbers that we are watching, which is the number of cases, but that lead to hospitalization and otherwise. However, we're in regular conversations with the Nevada Hospital Association and their members, and they're speaking directly to the governor and giving us updates daily on what their status and what their capacity is, and right now we're doing okay, and they're doing okay, which is really critical. And they're such a key asset to the communities throughout the state. So yeah, they're doing great. There's some really interesting things coming out of the hospitals. I heard the other day that the average length of stay 2 months ago, 3 months ago when all of this started, was about 16 days, and they've worked that down to about 11 days now for COVID patients. Okay. And a lot of that comes from doctors and nurses learning how to better treat this illness, learning more about it, and becoming more efficient. So there's a lot of positive coming out of the more opportunities we get to learn from this disease.
Well, good. And I hear being on a ventilator is not a good thing. So trying to really prevent that, it seems like.
Yeah, that's right. That's right. It's that's a very challenging part of the treatment. And again, not a doctor, but from what I understand, talking to our colleagues throughout the state, and they're learning things like putting the patient on a ventilator as late as possible in order to help with the treatment and those sorts of things.
So part of the spike we're seeing is an increase in testing. And how is our testing? Are we meeting the goals that you and the governor want to be meeting?
So again, it kind of goes back to your previous answer of yes and yes, and that is, we're never going to be satisfied with the amount of capacity that we have in the state, just because this thing is affecting people's lives on a daily basis, sometimes in very dramatic and traumatic ways. So testing is absolutely a critical part of Governor Sisolak's reopening plan, and that is because we have to know where the disease is, and we have to be able to create opportunities for intervention. So testing has really, as much as I say we'll never be satisfied, we'll always be pushing for more. The testing has scaled up incredibly in the last 3 months. The public health labs and the private partners throughout the state, I believe over the last 5 or 6 days, I'd have to go back and do the math, but I think they're running about 9,000 or 10,000 tests a day through all of the labs combined, which is an extraordinary number.
It is.
Given that we were, that those numbers are more probably than the labs would run through, would report through their process in a year for a public health incident.
Well, and considering 3 or 4 months ago, we didn't even know what COVID-19 was,
Correct.
let alone to how to prepare a test for it, to have a test, and to have that massive amount of number of tests.
Right. That's right. Yeah, and to go from doing small levels of testing for diseases within communities, public health response type things, to doing 10,000 a day is extraordinary, and that did not turn on overnight, and it did not turn on. It wasn't flipping a switch. It was a lot of work.
And I'm hearing now that they are trying to get people to come test for a vaccine, or I mean more vaccine, and they're trying to get healthy people to come test vaccines. So there's the other challenge now is, okay, is there a cure, and is that moving along?
Right. We have vaccine trials. We have antibody testing. We have the PCR tests as well.
Okay, very cool. What are you learning from other states?
Yeah, that's a great question. And what we're seeing in other states, there are states that are nobody's on the exact same path, right? Yeah. So the governor 2 weeks ago, just under 2 weeks ago, put out his order for masks in public spaces. So we hope to, in the next week and a half, we hope to see our numbers declining because of that. No state is doing it exactly like we are doing it, but we're monitoring very closely to see who's doing what and how can we benefit from that in the state of Nevada.
Well, we're going to come back and talk a little bit more about states and our economy right after this.
Dimitri Prine here for Design Outdoor. Come visit Design Outdoor's store and backyard to see our wide selection of fire pits, barbecues, and pizza ovens, natural stone water features and fountains, and frost-proof pottery. Our store and backyard are located at 11600 South Virginia, just north of DeMonte Ranch Parkway. Visit designoutdoor.com or call us at 851-9499.
Can't do it. Stupid, like my mom.
We can't do anything at Mommy's because you won't pay child support.
Dad said you cheated, and he's not even sure he's my dad.
Mommy said you left both of us, so she isn't gonna let me see you.
I look just like my father.
I'm divorce attorney Marilyn York, and I may represent men, but hate has no gender, only casualties. Please, stop sacrificing your children in your war against your ex.
Hi, I'm Dave Newman. Remember me? I used to be the house detective, and now I'm a realtor, full-time at RE/MAX Realty Affiliates. A lot of people ask me, how's the market? You know what? It's fantastic. If you're even kicking around the idea of buying or selling, give me a call. Let's talk about it. Call me at RE/MAX Realty Affiliates and just ask for the guy who used to be the house detective, Dave Newman.
Everyone is talking about opioids, but they're not the only drugs that can be harmful if taken in large quantities or not as prescribed. You also need to be aware of side effects from anxiety drugs, muscle relaxants, sleep aids, and stimulants. Mixing prescription drugs with other drugs or alcohol can be dangerous. If you take Ambien with a glass of wine, it may be enough to stop you from breathing. Prescribed drugs can be just as dangerous as illegal drugs. Take medications only as directed.
This is Nevada Newsmakers.
And we're back with Caleb Cage, the Director of COVID-19 Response for the state of Nevada. So on June 26th, Governor Sisolak instituted a mask mandate. I have to tell you, I was in California a while back, and nobody was not wearing a mask. I mean, everybody was wearing masks. I actually pulled my mask down in a store to talk to somebody, ask them a question, and they said, please put your mask up. So California's got it nailed, but I guess you guys aren't real happy that a lot of businesses around here aren't complying with that. Is it the people visiting? Is it the businesses? Because I see that there's this non-compliant hotline, which kind of made me a little upset. We have 30,000 people that can't get unemployment because they can't get through in a phone line, but we're going to set up a phone line for people to narc on businesses. So just from my perspective, there's a little like, I'd rather put resources toward helping people get unemployment. But there's a reason that you guys are really pushing these masks. Tell me the importance of a mask.
Well, the importance of the mask, and this was, the science on it was conflicting early on, and there were different interpretations of it. But I think that we're starting to see a consensus in the last month that if there is one thing that you can do, social distancing, washing your hands, washing shared surfaces, those sorts of things are all critical. But wearing the mask, especially in public, is really a critical part of that. And there's the science behind that and what you're actually doing, but it's preventing you from spreading the virus if you are an asymptomatic carrier or a symptomatic carrier. And it really reduces that, and so that is really the part behind it. And the fact is, we do not have a vaccine. We do not have a way for this to just go away.
Right.
And as much as we may want that, and as much as we may want to get back to normal, normal's not going to be here until that happens. And so there are things that we have to do in order to do that. And so the Department of Business and Industry, which oversees OSHA and many licensing agencies for the state, as well as other licensing bodies, and local partners as well, have been enforcing that. And it's mostly for businesses to ensure that their employees and their customers are safe. And it's a mechanism in order to look at that. Directive 24024, which was released on June 26th, that required the mask order. So while I understand that it's uncomfortable and it's inconvenient, and there are some concerns with it and critique, it's one of those things that will make a huge difference in the long run. And if we don't all do this together, then this is just going to be prolonged, and it's going to be even harder to keep open our businesses in the state.
So I'm one of those, I'm not a right-wing wacko, but I am a conservative. And a lot of the conservatives are saying, I don't want to wear a mask because I don't want government telling me what to do. It's not uncomfortable. It's not inconvenient. It's that I don't like government telling me what to do. And you know what? At this point, it's the right thing to do. And I think we've all got to realize that. It's a one little thing that we can do. So don't buy into the argument that it's uncomfortable and it's inconvenient. You don't need to do that.
Yeah, I guess I'm trying to give the benefit of the doubt. I would say, I don't like being told what to do either.
Right.
I appreciate you saying that. But I just look at it and I say there's really no alternative.
There really isn't.
And just do this. Even if it's uncomfortable for you or not uncomfortable, even if you don't like it, do this for other people. Do this to help us open the economy.
Well, especially, I have two 90-year-old parents at home. I do need to be careful. My husband, who had heart surgery a year and a half ago, I need to be careful with him. So all of us have somebody in our food chain, in our family, that we need to be protecting. So it's not just, it's do it for your family. But I also own a small business, and our employees wear masks, and we cater to pregnant women. They're all wearing a mask because they're already a vulnerable population. And we have a big sign on our door, you're not allowed in unless you're wearing a mask. So I think it's the little things that we could do for a few minutes that will help keep our economy open. So should I be concerned that the governor's going to shut down our economy again?
I think we got to watch the compliance numbers that are coming in, and I think that what I would really ask, and again, thank you for the opportunity to ask people to do, is to pitch in on this and to help, and to help us. We've got to monitor, as Dr. Schwenk said, we've got to monitor the hospital numbers. We've got to monitor the number of cases, which we are, and Nevada's on an uptick at this time, and so.
Do we think it's from casinos? I mean, do we know where it's coming from? Because I drove by Grand Sierra, and that parking lot's packed.
Well, right now we have our contact tracing effort is underway, and what I can tell you is, I don't know the exact number off the top of my head, but what I can tell you is, going back to the beginning, we've identified about 4,500 positives that would not have known to go get a test that they were positive because they were asymptomatic or otherwise. So of our overall numbers, it's a significant portion. We are getting online our ability to identify where they're from and where the cases may have come from, and so we can really look at where those interventions need to happen. So right now we don't have data showing a specific connection to an overwhelming specific connection to resorts and casinos versus anything else.
Okay, that's good.
But that data will become more clear in the near term.
Well, I know it's all a numbers game, and to me, the number is 22,000 cases, 230,000 unemployed. So let's really, we've got to remember those numbers. We've got to remember those jobs. We've got to remember those businesses that are no longer going to be around. There's lives and there's livelihoods.
That's right.
And you're trying to balance the two of them, and we appreciate you being there. We appreciate what the governor's doing, and we hope you'll come back and give us a little positive report in the not too near future.
I'm happy to do it. Thank you, Randy.
Good. Thank you, Caleb. Appreciate it. We'll be right back after this.
A bird's eye captures its surroundings at different heights. At Brian Culpa Photography, we can make your imagination soar over buildings, parks, cityscapes, and beyond. Brian's images tell the story and get the job done. If you need a new perspective to tell your story, contact Brian today. Brian Culpa Photography. Experience the bird's eye view at brianculpaphotography.com.
Hi, my name's Marilyn Miner, and I'm sure you'd agree that Nevada's a very special place to live. I was born here, and my husband and I have raised our family here. I feel it's a privilege to live and work in the Truckee Meadows. I especially enjoy helping my clients reach their real estate goals. Sometimes the smallest details provide the greatest satisfaction. I'd be complimented to talk to you about your next move.
Call Marilyn Miner at Dixon Realty, 742-1280, or log on to marilynminer.com.
Safety. We all think about it. You think about it when he buckles in, when you check your mirrors and put away your phone. RTC thinks about safety too. In fact, we create it. Center turn lanes mean fewer blind spots. Bike lanes keep cyclists and you safe. Roundabouts reduce injury collisions, and all these crosswalks are designed to keep families like yours safe. Safety is your priority, and it's ours too. Every day, in everything we do.
Pro Group Management specializes in providing industries with the necessary components to satisfy and exceed workers' comp requirements. Every business has unique needs and specific regulations. Pro Group Management stays ahead of the curve, providing up-to-date services to keep your industry in top form. Discover how we simplify your tasks, improve efficiency, and reduce expense to keep you moving in a positive direction. Pro Group Management, workers' comp that works for you.
Thanks for watching and listening to Nevada Newsmakers. Check us out anytime at NevadaNewsmakers.com as well as on YouTube. Thanks for listening.